my name's Amanda McAdams, and I'm going to be performing the health assessment of the abdomen on Valerie today.
Hi, I'm Valerie McAdams, and I consent to the use of this video for educational purposes.
So if you have any questions during this assessment, you can feel free to stop me at any time. So I'm just going to start by asking you a few questions. Have you had any change in your appetite lately? Any recent weight gain or weight loss?
No.
Do you have any difficulty swallowing?
No.
And any foods that you can't tolerate?
No.
Okay. Do you have any abdominal pain?
No.
No. Any recent vomiting or nausea?
No.
Okay. And do you have any history of GI problems?
No.
Do you take any medications?
No.
Okay. And how often do you have a bowel movement usually?
Once or twice a day.
Okay. And then I would just ask her about her diet, what she typically eats in a day. So I'm just going to start by inspecting your abdomen. So I'm going to have you lay down here. And just go ahead and lift your shirt for me, please. Good. So on inspection, her abdomen is symmetrical. The contour is flat. The umbilicus is midline. She does have a piercing present in the umbilicus. And no protrusion at the umbilicus. Her skin is smooth and is one color throughout. And I don't notice any labored breathing or any guarding. She does seem to be relaxed. No pulsations, only movement when she's breathing. So next, I'm going to be listening to your abdomen. So I'm just going to be listening for bowel sounds in all 4 quadrants. Starting with the right lower quadrant. Good. Bowel sounds are present in all 4 quadrants. It is normal to hear about anywhere from 5 to 30 bowel sounds per minute. Next, I'm going to be auscultating her vascular sounds of the abdomen, starting with the aorta. I am going to be using the bell and the diaphragm to auscultate the vascular sounds. Moving to the renal arteries. And the iliac arteries. And then the right and left femoral arteries. And I don't notice any bruit present. So next I'm going to be performing percussion throughout all 4 quadrants of the abdomen to check for tympany. I'm going to be using my dominant hand and tapping the non-dominant distal joint of the middle finger on the non-dominant hand, just with a quick tapping motion. To check for tympany. Good. No dullness noted. There was tympany throughout. And now I'm going to be percussing for to check the liver span. So I'm going to be starting in the lung fields where you would hear resonance and percuss down until I hear dullness, which would be the liver border. And this is done on the right midclavicular line. And I'm going to percuss in the intercostal spaces, because if you percuss over the ribs, you will hear dullness. And then where I hear dullness, I would just make a little mark. And I'm going to be percussing up from the lower abdomen, again, to where I hear dullness for the lower liver border. And again, I would mark that area, and then I would take a ruler and measure between the two marks for the span of the liver, which is usually about 6 to 12 centimeters. Next, I'm going to be percussing for the spleen, for any enlargement of the spleen. This is a little harder to do because the spleen is underneath the ribs. So I'm going to be going to the left mid-axillary line at about the 10th intercostal space. And take a deep breath in for me. And again, tympany is present, no dullness, which means no enlargement of the spleen. So next I'm going to be performing light palpation to get the patient used to the feeling of palpation, check for any tenderness in the abdomen. This will be done in all 4 quadrants. Using the pads of my fingers. Any tenderness?
No.
No. Okay, no tenderness. So now I'm going to be using a deeper palpation to check for any enlargements. I'm just going to be pressing deeper into the abdomen. Let me know if there's any tender areas. Any tenderness anywhere? No? Okay. No enlargement noted, no tenderness. So now I'm going to be palpating for the liver border. So I'm going to place my hand underneath your ribs. And I'm going to be placing my right hand parallel to the midline. And I'm going to be pressing under the costal margin. And I want you to take a deep breath in. And sometimes you can feel the liver border tap the tips of your fingers. And now I'm going to be checking for enlargement of the spleen using deep palpation, placing my right hand diagonal to the axillary line or to the axilla. Again, pressing under the costal margin. Deep breath in. Good. And I don't know any enlargement of the spleen. I'm also going to be palpating for the kidneys on the right side using a duckbill position. Deep breath in. No enlargement noted. And on the left side, deep breath in. Good. Again, no enlargement. And lastly, I'm going to be palpating her aorta. I'm feeling for pulsation with my thumb and pointer finger. And I do feel pulsation present anteriorly. And that will be the completion of the abdominal assessment.